Right, this is the eyeball cut in half, all right?
Right.
So you're looking at the inside eyeball. This is the front of the eyeball is called the cornea. That's the clear window in front of the eye. And then that is the pupil or the iris. And then behind the pupil is the lens of the eye. All right, now this is the cataract. The cataract is a lens that you were born with. When you were born, the lens was normal, the lens was clear, and you could see through it. As we get older, the lens ages, and as the lens ages, it gets more cloudy. And as it gets more cloudy, it interferes with your vision. So just like your hair changes and your skin changes as we age, this lens changes also. And so a way to think of it is, if this was a windshield on your car, and it got gradually dirtier and dirtier and dirtier, it would get to a point where you couldn't see clearly out of the windshield. So that's what's happening to the cataract as we get older. And it changes at different rates in different people, but eventually it will get cloudy enough that it will cause somebody to complain that their vision isn't clear. And at that point, we have to do something about it. If you can't give people glasses to make them see better when the cataract develops, then you have to decide whether you want to take it out or not. It's an elective procedure. You can take it out or you can leave it in. If you leave it in, you'll continue not to see well. But just like yourself, you realize finally that it's time to do something because you don't see well enough. So what we're going to do is we're going to have to take that cataract out, all right? Now, when you decide to have the surgery, the technician will set up the surgery. Most of the time we do the surgery at Garden Park Hospital. It's an outpatient procedure. On the day that they set up the surgery, you're going to show up at the hospital and check in. They're going to get you ready and put you in a gown and put you on a gurney, lying on your back. You're going to go into the preoperative area. They're going to dilate your eye just like we dilated today. And once your eye is dilated, the anesthesia people are going to start an IV in your hand. So you're going to have an IV in your hand. You're going to have EKG leads on your chest. You're going to have a blood pressure cuff on your arm. You're going to have an oxygen tube in your nose. And all of that is to allow the nurse anesthetist to monitor everything while I'm doing the surgery. So when we're ready for the surgery, they're going to give you a little bit of medicine in the IV to sedate you. So the anesthesia is actually sedation. We're not going to put you to sleep. You're going to still be breathing on your own. And when everything's ready and the eye is dilated, they're going to wheel you back to the operating room. When you get to the operating room, you're going to be lying on your back with your head right in front of me, and I'm going to be looking at the microscope, looking at your eye through the microscope from above your head, okay? Now, in order to remove the cataract, we have to make a little incision in the clear part of your eye, right where it blends into the white part, okay? The incision has to be big enough to let the instrument enter the eye. The instrument is the same size as this pen tip. The tip of the instrument is the same size as the point of that pen. It's about 3 millimeters. So all we got to do is make an incision big enough to allow this instrument tip to get into the eye. All right? So it's going to be at about 12 o'clock, since I'm looking at you from above. We're going to put a little speculum in your eye to hold your lids open so you don't have to blink. And then I'm going to make a little incision, like I said, right where the clear part blends into the white part. And if you look right here, you actually see an illustration of the instrument entering that little incision. And remember now, this tip of this instrument is the size of a pen tip. Okay, the instrument is going to actually chew up the cataract. It's going to just pulverize it into little pieces. And as it pulverizes it into little pieces, the little pieces get sucked out of the eye into a tubing. And that's how we get rid of the cataract. We actually chew it out, okay? This is called phacoemulsification, but it's an ultrasonic probe that chews the cataract up and sucks the pieces out, all right? So now if we move over here and you look at this illustration and ignore that lens for a minute, you see an empty space here where the cataract used to be. The way to think of the cataract is as though it were a grape. If I took a grape and I put it in my hand and I took a very fine knife and cut a little opening on the top of the grape and took the little skin off the top of the grape, and then I sucked all the pulp out of the grape, what I would be left with is a grape skin, an empty grape skin, sort of like a twice-baked potato. You cut the top off, you get all the potato out, all you got left is the shell. So what we did with the cataract is we cut a little opening on the top, we chewed up the little pieces of the cataract, sucked them out. So now what we have left is what we call a bag, a capsule or bag, but it's like the grape skin. It's like the empty grape skin. You can see that, all right? Now, we took out the cataract. The cataract is a lens. And because it's a lens, a very powerful lens, if we stopped right now and sent you home, you couldn't see. You would be like a camera without a lens. If I took my camera, took the lens off and gave you the camera without a lens, you couldn't focus the camera, you couldn't use the camera. So when we take your cataract out, if we send you home without replacing the lens that we took out, you couldn't focus your eye. So the next thing we have to do is put a little artificial lens in, and you can see this right here. This artificial lens that you're looking at here is made of silicone. It's actually the size of a fish scale. So the actual size of that little lens is a flimsy little thing like a fish scale. So we take that little fish scale size lens and fold it in half. And you can see I'm putting it in the eye. I'm putting it where the old lens used to be, in that capsule, in that grape skin, an empty skin. When I get it where I want it, I let it go and it opens up. And now you can see that the implant or the intraocular lens is oriented exactly where the old cataract used to be. So at that point, we finish the surgery. That takes about 15-20 minutes. We have one other thing we have to talk about, and that is the wound that I created. The wound is very small, like I said, about 3 millimeters. In about 97% of people, I do not have to put a stitch in that wound, okay? Because it seals itself. But I make that determination at the end of the surgery. I touch the wound and see if it's tight enough. If I don't feel it's healed well enough by itself, then I'll put a stitch in it. If I do put a stitch in it, you wouldn't know whether I put a stitch in it or not. You're not going to have any idea unless I tell you the next morning that I did or I didn't. And if the stitch has to be removed, we can remove it right here from the office. I have somebody I did about a month ago, and I took her stitch out today right here in the office, okay? So it's just a safety gap, all right? But most of the time, we do not put a stitch. All right, at that point now, we finish with the surgery. We send you home, we send you back to the recovery area. You sit in the recovery area for about 30 minutes, and then you go home. When you go home, you have 2 eye drops that we have sent to the pharmacy. One is an antibiotic and one is a steroid. You're going to put each one of those drops in 4 times a day, starting from the time you get home. And then you're going to come back and see me the next morning, and I'm going to examine you and make sure you're doing okay. And then I usually see people 2 consecutive mornings. So I'll see you, I'll do the surgery on a Monday, usually. I'll see you on a Tuesday and Wednesday. And then I'll see you back in a week after that. And then 2 more consecutive 2-week visits. And at that point, we'll be about 4 or 5 weeks after the surgery. And then we decide whether you need glasses or not, okay? The power of the implant is determined by some measurements that we're going to take here in the office, and we're going to calculate the power of the implant that is for your eye. It might be different than for my eye, or her eye, or his eye, so it's going to be custom determined for your eye to allow you to see distance clearly, all right? Now, there are 3 myths that I talk to people about, which I have found to be most common myths about cataract surgery. The first one is that cataract surgery is laser surgery and you don't have to go in the eye. That's not true. Cataract surgery is not laser surgery. Like I showed you, you got to go in there and take the cataract out. Now there is some confusion because now we have a laser which allows us to beat up that cataract a little bit before we go in and suck it out. And the laser breaks the cataract into little pieces. I don't recommend that right now because it's very new technology. But we still have to go into the eye and take the cataract out. So anybody who tells you they had laser surgery doesn't know what they're talking about. It's not laser surgery. That's the first myth. The second myth is people think you don't have to have glasses after cataract surgery. You might have to have glasses after cataract surgery to get your best vision. The purpose of calculating that implant power, in my case, is to try to get you to see distance clearly. All right? But it's a calculation. So about 60% of the time, it probably helps people function without glasses. But about 40% of the time, they need glasses. So what we're doing is, this is not surgery to replace glasses. I do that surgery to get rid of glasses, but that's not what this is. The purpose of this surgery is to get rid of the cataract so I can give you new glasses, which I can't do now because your cataract's too bad, okay? So that's the second myth. You might have to wear glasses after surgery, and we're just not going to know that until 4 or 5 weeks after the surgery. And the third myth is, what is your vision going to be like when you come out of the operating room? All right, this surgery chews up this cataract, and there's a lot of energy produced when you do that. And that energy sometimes causes the front clear part of your eye to swell. If the front clear part of your eye swells, you're not going to see clearly. It'd be like a foggy windshield early in the morning. You can't see, all right? But if your cornea swells, that's normal. But if somebody said to me, is Joyce's cornea going to swell? No, I don't know if it's going to swell or not. I'll tell you after the surgery. But you're going to talk to a lot of people who are going to tell you fish stories about their experience with cataract surgery. And they're going to tell you, oh, I had surgery and I don't have to wear glasses and I can see immediately. That's just a fish story, all right? That's like saying the fish I caught was this big, you know, a foot long when we were with him and we know it was 6 inches, all right? So, but it's so common that people go home and they cover their unoperated eye and they look through the operated eye and they can't see. And they get upset and they get worried. They come back the next morning and they're worried because they talked to their aunt or their uncle or their cousin who told them that they could see good after cataract surgery and they're worried, okay? So we don't want you to be concerned if you can't see. If you can't see, that means you have swelling. If you can see, that's great, okay? I have to admit to people, if I had surgery, as soon as I left the operating room, I'd probably cover my other eye to see if I could see. So that's understandable that people would do that, but I don't want them to think that anything's wrong if they don't see as good as they think they don't see, all right? So that's the 3 myths. That's what we're going to do with cataract surgery.